For this week, I will be discussing medications for borderline personality disorder. And a bit of background on borderline personality disorder. As our textbook defines it, it is a type of personality disorder that has a pervasive pattern of unstable interpersonal relationships, self image, affect, and impulsivity. And the symptoms of borderline personality disorder include intense moments of long periods of time of anger, depression, and anxiety, substance abuse, self injury, and hostility towards those around them, frequent changes in long term plans and goals due to self worth and sense of self, and in some extreme cases, the feeling of not feeling like oneself at all. And this disorder is challenging to identify based off of the criterion symptoms, in that it can easily get intertwined with other disorders learned in the past. But as we learned, it must remain persistent and must interfere with a person's way of life in order for it to be diagnosable. So, why focus on medication? Our textbook doesn't go in depth towards medications of borderline personality disorder, and it's due to the fact of the severity of symptoms and the substance abuse that patients shown that makes it difficult to really medicate someone. So, I wanted to go more in depth towards medication. Currently, the medications used for BPD range in different forms depending on the severity of the symptoms. This includes antidepressants, mood stabilizers, and antipsychotics. While this does help the patient lower their severity, it only reaches surface level. It doesn't necessarily help them regulate emotions or mindfulness of self. Here comes the first study, which was conducted asking patients with BPD on their experience with medications given to them in a hospital. So each participants were interviewed by a staff member of the research group instead of the care coordinator, and this helped the patients feel more comfortable disclosing their experiences. And the questions included how participants were informed of this treatment, if they had any input into the decided treatment, and what the benefits/disadvantages of medication are. Unfortunately, this study did have grim results in that many did not have prior knowledge or information given to them about their diagnoses, which makes them feel lost and confused on why they were there. And many of them did call out saying that their caretakers told them that there was no medication that works for their type of diagnosis. And instead, they were just given medication that would only help a certain part of their symptoms, which seems grim and terrible to really know and to understand that this is happening. And so far, as we learned, the current treatment given for those with BPD is dialectical behavior therapy, which helps them understand and regulate their emotions and regulate their mindfulness and sense of self. So here comes the 2008 study on the olanzapine for the treatment of borderline personality disorder. And olanzapine was actually in a previous study used to see if it could work as or if it could function as an antipsychotic. So, to summarize how the study was conducted, it was conducted within a 12-week period, and each of the patients were either in a group of olanzapine versus a placebo group, and they were each assessed within the weeks. And for those that didn't meet weekly, they would have telephone calls. And some of the questions included asking them about their severity of symptoms, if they experienced any weight gain, if they experienced any changes in their mood or self regulation, or etc. Unfortunately, the results of the study did not prove to be as effective as they wanted it to be. As you can see with the mean dosage increase and with the greater weight gain, olanzapine group did suffer a bit more of a higher mean, as well as the percentages of completed with discontinued. And to summarize the discussion given towards the study, olanzapine proved to be successful in helping borderline personality disorder patients, but by itself, it was not as effective. So this comes to the state of the future. What happens now? If olanzapine by itself doesn't help, what else can we do for those with BPD? Well, the good news is that there is hope. So, since the 2008 study, new studies have been emerging more and more each day. And this means more medication and more research towards those with BPD is emerging. And some of the medications that have been studied have been omega-3 fatty acids, olanzapine, and valproate. And also better treatment has also helped. such as medication combined with psychotherapy. It has proven to be effective for those with BPD instead of one or the other. And the biggest takeaway I want to take is working with the patient. Kenneth Silk writes an article for the Journal of Psychiatric Practice on how to treat someone with BPD and how to manage medications. And the biggest takeaway was allowing the patient to make their own decisions and working with them. And if they're already on a medication, do not change their medication. Let them stay on that medication because it's what they felt most comfortable and what functioned them the most. So, while obviously there's still more research conducted in finding the medication that works best for the patient, it's a good thing that now our future is seeing a bright light in that maybe one day there will be one type of medication used for borderline personality disorder instead of multiple medications used currently. And here are my resources, and I hope you enjoyed my presentation.